which climate change is impacting mental health. So the different mental health outcomes that are being affected by our changing climate. And then in the second part of the lecture, I'm going to focus a bit more on solutions and what are the interventions that we can implement to protect and safeguard mental health in the context of climate change, but also what are the co-benefits to mental health that come from climate action. And throughout this lecture, if let's just keep it very informal. So if there is anything that isn't clear or any questions that you have, feel free to drop them in the chat and or raise your hand, and I'm very happy to stop and answer sort of any questions as we go about. But then we will also have some dedicated time for questions at the end. So in terms of the impacts of climate change on mental health, the first thing to highlight is that from a methodological and research perspective, it's not always very easy to determine how climate change is impacting mental health. And this is because of a variety of reasons, but I'm going to here mainly focus on two different reasons. One is about attribution, and the other is about sort of mechanisms and pathways through which climate change impacts mental health. And I'm going to kind of explain a bit using these two images. So when I speak about attribution, I mean, how do we know that climate change is causing an impact on mental health? And in this image on the left, you can see sort of on the left, all-cause disease burden. So kind of all the different illnesses, mortality, morbidity in the world. And we know that a lot of it will be caused by factors that are not attributable to climate change. So here on the top, so you see things like socioeconomic determinants, one's genders, one's economic situation, one's housing. And then we would have a subset of this burden that is sort of caused by climate attributable burden. But even when we speak about climate attributable burden, there are a number of different factors that are likely to sort of be under this bucket. So we have things like seasonal patterns, which are unrelated to climate change. And we also have climate-related changes that are not due to humans. So, for example, we know that we have external forces that can impact our climate, things like volcanic activities. And then we also have sort of temporal patterns that can impact climate. So, for example, you may be familiar with the El Niño phenomenon. So, again, that's a sort of natural variation in our climate that can impact disease burden, but that is unrelated to human-caused climate change or anthropogenic climate change. So when we're speaking about the impacts of climate change on health or on mental health, what we're really interested in is this sort of pathway highlighted in red. So the attributable, the changes in mental health burden attributable to human-caused climate change. And it is often very hard from a methodological perspective to really zoom in specifically on this aspect because it's very difficult often to disentangle human-caused climate change from the variety of other factors that are impacting health. So this is one first challenge that regarding attribution, which means that it's often difficult to assess how climate change is causally impacting mental health. And then the second reason why it is often quite challenging to study the impacts of climate change on mental health is because both climate change and mental health are very complex. They are complex systems that are impacted by many different variables and factors. So if you think about climate change, again, very complicated. It's caused by a number of different things and leads to a number of different factors. And similarly, mental health is very complicated. So for example, this graph shows the pathways through which droughts, so again, you see here the kind of main factors in this kind of green cloud, the way in which droughts impacts mental health, and mental health are the factors here on the kind of top right of the graph. So suicide, depression, and depressive symptoms, and again, you see how many different pathways lead from the exposure, drought, to the mental health outcomes, depression, suicide, anxiety. And again, this highlights how complex it is often to establish the association or the link between the climate exposure and the mental health variable. So, having said this, there are ways in which we can sort of attribute climate change to a number of health outcomes. This to date has mainly been done in the context of physical health, and particularly when it comes to attributing climate change to specific health outcomes, it tends to happen with outcomes that are quite sort of hard or sort of that are categorical or easy to measure, things like death, mortality. And in these cases, we can actually make quite a good estimate of what is the additional burden that climate change is causing, for example, when considering mortality. So I'm just going to mention here one study coming from the European context in which they were able to really isolate the additional number of deaths that were specifically due to anthropogenic climate change in the context of the 2020 summer heat waves. And they found that approximately half of all deaths were specifically attributable to warming, which was caused by human-caused climate change. When controlling for, the fact that summers are naturally warmer than other seasons during the year in Europe, they were able really to zoom in this specific aspect. But moving now to kind of mental health, which is going to be the focus of this first part of the lecture, I'm now going to go through the different ways in which climate change has been shown to impact mental health. But before I do that, I was just curious to get maybe some thoughts in the chat around ways in which you think climate change is impacting mental health. So when you hear the words climate change and mental health, what are the first things that come to your mind? What do you think are some of the impacts, some of the pathways, some of the kind of mechanisms? So I'm going to maybe leave just 1 minute or so for people to share any thoughts that you may have in the chat on climate change, on the ways in which climate change is impacting mental health. So if people want to maybe type in the chat.
And doctor, the participants are a bit huge, so that it will not be feasible for interaction in the lecture, but in the question and answer session, we will give an
Perfect. That's completely fine. But yes, if people then want to use the chat, feel free to do so. But just to
yeah.
then to go through the different elements on impacts to which climate change is impacting mental health, I will start by focusing on air pollution. And air pollution per se is sort of distinct from climate change, but the underlying causes that air pollution and climate change have are often shared, which are related to the burning of fossil fuels, which contribute both to air pollution in our atmosphere, but also to climate change and to global warming. So when we speak about air pollution has a huge impact on our health, both physical and mental. So we know that approximately 8.3 million people die every year because of air pollution, and that the majority of these deaths are because of the burning of fossil fuels. So things like petrol, gas, and other fossil fuels. So, as I mentioned, air pollution has a huge impact on our physical health, whether that mainly has to do with non-communicable diseases such as respiratory conditions, cancers, but also air pollution has an impact on our mental health, and we are increasingly seeing evidence on how air pollution is impacting mental health, particularly the evidence that is out there in terms of kind of the most robust evidence is around air pollution and depression and air pollution and suicide. But we also have pretty strong evidence that air pollution can impact neuropsychiatric or neurological conditions. So, for example, we know that air pollution is a risk factor for the development of dementia, such as Alzheimer's disease and other related conditions. What we don't know really well yet is what are the kind of mechanisms that might explain the association between air pollution and mental health. So we tend to see that people exposed to higher levels of air pollution tend to be at higher risk of, for example, experiencing depressive symptoms. What we don't really know yet is why these associations happen. And this is probably the result of a complex interaction of biological, psychological, and social factors. So, to give you an example of the link between air pollution and mental health, I wanted to show you a case study coming from China that looked at the relationship between air pollution and suicide. And the study used a huge, very comprehensive data set accessing suicide rates across all of Chinese counties. And again, what they found was that there was a positive association between air pollution and suicide, so that increases in air pollution were associated with higher levels of suicide rate. But most importantly, what they found was that when air pollution decreased, we also saw a decrease in suicide rates. And they used China's Air Pollution Action Plan, which was a plan that was implemented across China to reduce the levels of air pollution. And they found that the implementation of this cleaner plan prevented approximately between 13 and 79,000 deaths by suicide, which again, in terms of suicide prevention strategies, is a really significant number. China's suicide rate was already decreasing, but what the study found was that 10% of this decrease could be attributable to the reductions in air pollution. Again, highlighting how clean air strategies are ultimately also mental health strategy because they do have a direct impact on mental health. And I think this also highlights an important point around conceptualizing fossil fuels as a commercial determinant of mental health. So we're seeing increasing interest in the kind of commercial determinants of health sphere, and these are things like alcohol, tobacco, unhealthy foods. But we're also seeing how fossil fuels themselves are increasingly being understood as commercial determinants of health, for example, by the World Health Organization, highlighting how they are directly impacting our physical and mental health. Another exposure that is obviously very relevant when it comes to thinking about climate change is heat. So we know that one of the main ways in which climate change manifests itself in the world is through global warming and people being exposed to more frequent, more intense, more long-lasting episodes of extreme heat. And extreme heat can have a number of consequences and impacts on mental health. And I'm going to focus here on the three outcomes that have received the most attention and that have the most evidence. So the first way in which climate change can impact, extreme heat can impact mental health is by making people living with pre-existing mental health conditions more vulnerable. So for example, we know that people living with certain mental health conditions, for example, psychotic disorders such as schizophrenia, are at a much higher risk of dying during episodes of extreme heat. The second outcome is concerning hospital admission. So again, we know that people living with mental health conditions are at a much higher rate of being admitted to hospital during periods of extreme heat, both in terms of hospital admissions for psychiatric emergencies, so people getting worse or experiencing a relapse during episodes of extreme heat, but also emergency hospital admissions, for example, in relation to heat strokes or heat-related illnesses that people living with certain mental health conditions are more likely to experience. And finally, as with air pollution, one of the outcomes that we tend to have the most evidence for is increased rates of suicide or suicidal behavior during episodes of extreme heat. So just as with heat, and we don't have time to go into kind of interactive breakout rooms, but I'm just going to suggest that you maybe have a think about kind of what could explain this association. So just as with air pollution, with heat as well, we tend to see these associations, but what we tend to see less of is evidence and research trying to explain why these relationships happen. What are the mechanisms? What are the pathways that explain how heat is impacting mental health? And again, as with air pollution, this is likely to be the result of many different biological, psychological, social factors interacting together and impacting mental health. And I'm going to give you a sort of brief outline of biological, psychological, and social mechanisms that might explain the relationship between extreme heat and mental health. So, starting with possible biological mechanisms, we know that certain neurotransmitters are related both to our body's ability to regulate temperatures, but also to mental health. And particularly neurotransmitters such as serotonin and dopamine are neurotransmitters which have been seen to be involved in bodily thermoregulation, so the ability that our body has to regulate its own temperature. But we know that serotonin, for example, is associated or is supposed to have a role in mood disorders, and dopamine is thought to have a role in psychotic disorders. So again, neurotransmitters might have a role to play when it comes to explaining this association. We also know that heat impacts every organ of the human body. So it impacts our kidneys, it impacts our heart, but by impacting every organ of the human body, it also impacts our brain. So potentially some of the mental health impacts of extreme heat are the result of the direct physiological impacts that heat can have on our central nervous system. Additionally, people living with mental health conditions, particularly chronic or severe mental health conditions, can often live with comorbid physical health conditions, which put them at higher risk of experiencing the negative impacts of heat. So they might live with cardiovascular, respiratory conditions, metabolic health conditions, which again might make them at a higher risk of being vulnerable to the impacts of heat. And finally, people living with mental health conditions can sometimes take specific medications. And some have suggested that some of these psychotropic medications might, as a side effect, impact the body's ability to thermoregulate. So, to give you an example, this is a topic that has received quite a bit of attention, both in the press, but also in research. And indeed, we do tend to see epidemiological evidence showing that people taking certain psychotropics, so for example, certain antidepressants and certain other types of psychotropic medications, such as certain antipsychotics, tend to experience worsened outcomes, health outcomes during extreme heat. So, for example, they might be more likely to be hospitalized, they might be more likely to die in the context of extreme heat. What we don't know very well is whether this is specifically due to the side effects of these medications or whether, it might also have to do with many other factors that might affect the life of a person taking psychotropic medication. So we know that people that live with mental health problems, for example, might have a number of other vulnerabilities. They might, for example, live in poorer neighborhoods. They might have less access to adaptation mechanisms such as air conditioning. They might be more isolated. So often it's very difficult from a research perspective to isolate the impact of medications from a number of other confounding factors that might contribute to this association. And actually, when we look at the pharmacological evidence, there isn't a huge amount of literature looking specifically at the pharmacological nature of psychotropic medications and their potential to impact thermoregulation. So although this is a topic that is receiving a lot of attention, we actually don't know a huge amount in terms of the pharmacological evidence for these drugs. There are, besides the biological mechanisms, there's also kind of psychological related mechanisms. So, as many of you may kind of experience when we are in very warm or hot temperatures, we might feel that impacting our mood. So, we might feel, for example, more nervous, more irritable. And so, again, by impacting mood, extreme heat might impact our mental health as well. Additionally, people living with certain mental health conditions, particularly severe or chronic mental health conditions, might experience something known as compromised insight, which means that they might not always respond appropriately to the conditions that they find themselves in. So, for example, they might dress very heavily despite the fact that it is very warm outside, or they might not drink enough, or they might sort of fail to place themselves in shade. And all these can impact, obviously, their exposure to heat. And finally, probably the mechanism that has received the most attention is sleep. So we know that extreme heat can impact sleep, both our sleep quality and our sleep quantity. So we tend to fall asleep later, we tend to wake up more frequently, and we tend to wake up earlier when we're exposed to episodes of extreme temperature. And obviously, sleep and mental health are related. We know that people living with mental health conditions often experience disrupted sleep, but we also know that experiencing sleep disruptions can then negatively impact mental health. And for those of you that are interested in climate and health, the go-to academic sort of paper is the Lancet Countdown on Health and Climate Change, which lists a number of different indicators that can be used to track the impacts that climate change is having on health. And one of these indicators is sleep. And what the Lancet Countdown found that was that because of climate change, the number of hours of sleep that had been lost due to high temperatures had increased by 5% when comparing the 1986 to 2005 period to the 2019-2023 period. So again, across the world, we saw that a very considerable number of hours of sleep were being lost because of the extreme temperatures that we are experiencing because of climate change. And finally, besides the biological and the psychological mechanisms, we also have a number of social mechanisms that are likely to explain the association between heat and mental health. So, for example, again, as many of us will experience, when it is very warm outside, we might have to change the way we live, our habits. We might not be able to exercise outdoors. We might not be able to spend time with other people, friends, family member outdoors. So all these disruptions and routines can contribute to people struggling with accessing the usual coping mechanisms, for example, that are good for our mental health, such as socializing, physical exercise. Again, some people might be stuck at home because they don't feel like they can get out in in nature or in the city, and this can contribute to their social isolation. Additionally, people living with certain mental health problems, as I mentioned before, often tend to live in lower socioeconomic neighborhoods, which might have less access to green space, and therefore impacts such as urban heat island effects might be more pronounced, or they might just not have the sufficient means to, for example, buy a fan, to access air conditioning. So again, they might be more exposed to heat. And finally, one of the links that we see the most during episodes of extreme heat is the impact that heat can have on episodes of violence. So again, during extreme heat waves, we tend to see higher rates of aggression, higher rates of violence. And to give you an example, this was a study that was published in The Lancet looking at how extreme heat in Pakistan, Nepal, and India impacted different types of interpersonal violence. And what it found was that with every 1 centigrade increase in the annual mean temperature, we saw an approximate increase in interpartner violence of nearly 5%. So again, this might be another mechanism through which heat impacts mental health, because obviously being exposed to violence is a negative impact on mental health. So we've spoken of air pollution, we've spoken of extreme heat. The other way through which climate change is impacting the world in which we live is by making extreme weather events more frequent, more long-lasting, more extreme. And again, many of us based in the different places in which we live, might have experienced floods, droughts, storms. And again, all of these are being made more frequent, intense, and long-lasting because of climate change. And extreme weather events can impact mental health mainly in two ways. So there is a direct pathway through which extreme weather events can impact mental health, and that is by exposing people to potentially traumatic events. So if somebody lives through a flood or a storm or a hurricane, they might experience death, serious injury, and all of these potentially traumatic events can be a risk factor for the development of certain mental health conditions such as post-traumatic stress disorder, depressive disorders, anxiety. At the same time, people that live through things like floods, droughts, storms, their lives will change after the event. So they might lose their jobs, they might lose their house, and all of these are known as the social determinants of mental health. So there are things in our context that impact the way that we experience our mental health. And again, by worsening things like housing, employment, extreme weather events can also negatively impact mental health. I think one really important thing to highlight, however, when it comes to extreme weather events, is the distinction between sort of distress and disorder when we speak about mental health. So, after a flood, after a storm, after any extreme weather event, everybody will be psychologically distressed. They might feel worried, they might have trouble sleeping, they might feel sad. Those are all normal reactions to an abnormal event. And we know that the majority of people will recover naturally with their own resources, with their social resources, with their family support. So again, psychological distress at the beginning of immediately after an emergency is not necessarily indicative of a mental health problem. It's normal for people to experience psychological distress in the aftermath of emergencies, but the majority of people will be resilient in the long term. However, a minority of people will then go on to experience and develop mental health problems in the aftermath of these events. And usually that is a minority, but when we think about very large scale disasters, even if it is a minority, it might be a substantial number of people that could still have an impact, for example, on the health system of a region or of a country. Additionally, we know that people living with pre-existing mental health problems, so people that were already living with mental health conditions before the extreme weather event, are more vulnerable in the context of extreme weather events. So they might be more likely to experience a relapse or a worsening of their condition, and also they might just be generally more vulnerable socially in the context of these events. So, for example, they might be more at risk of experiencing human rights abuses. Another way through which climate change can impact our mental health is by impacting our physical health. So this is probably the area, as I mentioned before, where we have the most evidence on how climate change impacts health. And there is a variety of ways through which climate change is impacting health. To give you some examples, we know that increases in temperatures are increasing the prevalence rates of certain infectious diseases. So, for example, vector-borne diseases such as dengue, malaria, Zika, but also foodborne, waterborne diseases. Climate change is also contributing to undernutrition and a number of health outcomes connected to nutrition. And again, we know that experiencing these physical health impacts of climate change can then have cascading impacts on our mental health. And finally, obviously, we can't have a introduction to climate change and mental health without speaking about these emerging constructs which are related to how people feel about climate change, the kind of psychological and emotional responses to climate change. So you may have come across terms such as climate anxiety, eco-anxiety, ecological grief, solastalgia, and we don't really have time to go into each of these different terms, but these terms usually are meant to refer to the emotional and psychological responses that we have to climate change. One important thing to highlight is that these terms are not necessarily mental health problems. So feeling worried, feeling concerned about climate change, in most cases, will be normal. And actually, we tend to see that feeling worried or anxious about climate change in certain cases can help us act on climate change. And so it can be seen as an adaptive response that can help us to fuel our sense of agency in trying to address and respond to climate change, rather than seeing them as a mental health problem. This is not to say that in certain cases, climate anxiety, eco-anxiety can also have a negative impact on people's mental health, and that people should be supported in managing these emotions. So we're quite short on time, so I might very quickly go through some of these last slides on the impact section, and then move to the part on solutions. One area that I obviously wanted to highlight is that despite climate change being a global phenomenon, and so the fact that climate change ultimately is impacting every single one of us, that impact is not happening equally. So based on pre-existing vulnerabilities, climate change is impacting some of us more than others. So certain groups of people, and globally, that tends to be people living in countries that have been historically the least responsible for climate change, such as, for example, countries, low middle income countries, are bearing the brunt of the health impacts of climate change. And that's at a global level. When looking more specifically at certain populations, I just wanted to highlight two populations that tend to be particularly impacted by climate change. And one of that is agricultural workers and farmers. And that is largely because they are communities that are heavily reliant on the environment for their livelihoods. And we, for example, have some quite good research coming from India highlighting how climate change, by contributing to phenomena such as droughts and other environmental phenomena that can impact crops and agricultural yield, is also contributing to worsened mental health among farmers. So, for example, one study using data over 47 years in India found that high temperatures due to climate change were associated with a higher number of suicides among farmers. Um, and we tend to, again, see this replicated also in other studies. Another group of people that tend to be at higher risk of experiencing mental health impacts of climate change are people residing in institutions. And that is often because people residing in institutions might be more exposed to extreme heat, because these settings might be less prepared or less able to adapt to the impacts of climate change. And people residing in prisons is a good example. We tend to see evidence, especially from the United States, finding that during episodes of extreme heat, we tend to see, for example, increased rates of suicide in prisons. And another topic that I think is very interesting is thinking about people residing in long-term psychiatric institutions and how they might experience the impacts of extreme heat. Although I'm not aware of any sort of research focusing specifically on this group, but it's likely that many of the factors that are shared by people residing in other types of institutions, such as prisons, might also translate into people residing in long-term psychiatric institutions. So for those of you that are really interested in climate change and mental health research, you may want to access this project, which was a Wellcome funded project and led by the Climate Cares team at Imperial College London, that worked on creating a global research agenda on climate change and mental health. And they have both a global level document, but they then also have individual documents for each of the different WHO regions. So you would be able to access a research and action agenda specifically, for example, for the African continent, or if you're interested in other regional settings, for other regional settings. And in addition to that, they also have specific research agendas for indigenous communities, young people, and farmers and fisher people. So again, if you're interested in these specific groups, do consult the Connecting Climate Minds project, and you will be able to find many resources that may be of interest. So moving now to the kind of last 10 minutes, I wanted to finish by highlighting possible solutions that can help us to prevent and address the mental health impacts of climate change. So when we speak about solutions in the context of climate change, we tend to think of two big buckets of actions: adaptation and mitigation. And to explain them very simply, adaptations are the actions that we can take to address the consequences of climate change. So things like floods, disasters, how do we prepare ourselves for these events? How do we protect ourselves and our communities from the impacts of climate change? So how do we adapt to climate change that is already happening or that we know will happen in the future? Mitigation, on the other hand, is how we manage and address the causes of climate change, which we said before is mainly the burning of fossil fuels. So it's about how do we reduce our greenhouse gas emissions to reduce the risk of climate change worsening in the future. So again, adaptation is about how we manage the consequences, and mitigation is about how we manage the causes of climate change. And again, we don't have time to go into kind of interactive sessions, but you can sort of start thinking about kind of what could be some of the mental health benefits of adaptation and mitigation strategies. And I'm going to use this infographic developed by the World Health Organization last year ahead of COP29, which highlights again some of the benefits for health that come from different types of climate action. This graph is mainly focused on mitigation. So again, actions that reduce the greenhouse gas emissions when it comes to climate change. But again, it highlights how different mitigation actions can also have important health co-benefits. So again, let's think about a couple that are shown here. So active transports. So we know that moving away from sort of cars can have a number of positive impacts on the environment. So things like cycling, walking, it can reduce the burning of fossil fuels, and it can also simply just reduce air pollution in the cities that we live. At the same time, it can also have a number of positive impacts on our health. It can have positive impacts on our cardiovascular, on our lung health, but also on our mental health, because we know that physical activity is a pretty strong predictor of good mental health. Similarly, increasing green spaces, blue spaces can have important impacts on our mental health, but also ensure that we potentially reduce greenhouse gas emissions. And again, there's other types of examples, such as making our houses more energy efficient, improving our diets to make them more locally sourced, more sustainable. And again, these are all actions that can have important consequences, both for our environment, but also for our individual health. And I just wanted to highlight two examples, one from the adaptation area and one from the mitigation area, of how climate action can have important co-benefits for our mental health. So when it comes to adaptation, one example I wanted to give has to do again with heat. And in many places around the world, when heat waves are predicted to happen, early warning systems are put in place through which, for example, cities prepare for the impacts of extreme heat, and actions are put in place to safeguard and protect people from the impacts of heat. And one example of a early warning system that integrates mental health considerations is that of the Southern Australia heat warning system. And what happens is that when a heat wave is projected to happen in the next, couple of days or weeks, people living with mental health conditions are notified, and also daily check-ins by their, for example, doctor is planned in order to check on them and check that they're doing okay, that they have everything they need in terms of water, food, and if the person doesn't respond, then a police visit is scheduled at their house to check whether everything is okay. So again, this is an example of an adaptation measure, so an early warning system for heat, which integrates mental health and that really targets people living with mental health conditions as a group that needs specific support when it comes to extreme heat. And research has shown that these type of interventions can be cost effective because they will ultimately help reduce all of the negative health impacts that we have spoken about before when we think about heat and mental health. So again, hospitalizations, mortality, and so on and so forth. When it comes to mitigation, I wanted to give you an example from Ireland about that has to do with housing. So again, this government-led project tried to provide energy updates to people living in energy poverty, and that also were living with chronic respiratory conditions. So what they did was that the government helped people to upgrade their houses when it came to energy upgrades. So, for example, to improve insulation in their houses and to make their houses warmer and healthier to live in. And that has implications for mitigation because it helps housing and energy become more sustainable, to waste less energy, to ensure that the house, again, runs off, for example, solar panels and therefore reduces greenhouse gas emissions. But what they also found was that by reducing energy poverty, that also had a number of important benefits for both the physical and the mental health of people living in these houses. So again, it highlights how actions that can have a positive impact on the environment can also have an important and positive impact on our health, both physical and mental health. Having said this, most of the research to date when it comes to climate change and mental health has focused on impacts. So it has focused on the first part of the lecture, so on measuring how climate change is impacting mental health. And we unfortunately know less about what interventions can be implemented to protect the mental health of people exposed to climate change. So I'm just referencing here a couple of scoping reviews or systematic reviews that touch on these topics for those of you that might be interested. And when it comes to measuring the co-benefits for mental health coming from adaptation or mitigation action, so what I've just mentioned before, unfortunately, we don't have a lot of robust evidence. So most of the evidence we have tends to be anecdotal. So coming from policies or projects that are being implemented, but that are not being evaluated in a scientific way. So for example, we currently only have 2 randomized controlled trials testing the impact that adaptation and mitigation actions have on mental health. So again, just to say, we have much more research on the impacts, a lot less research on interventions and co-benefits, and we need to be better at collecting that type of evidence. And this is reflected in policies, by which I mean that often climate change policies do not necessarily cover mental health very well. So to give you just one example, one of the most important policies that countries develop when it comes to climate change is what is known as nationally determined contributions, or NDCs. And these are the policies that countries develop every 5 years to show how they are aligning with the goals of the Paris Agreement, which some of you may remember is how do we keep the temperatures at below 1.5 degrees compared to our pre-industrial periods. And countries every 5 years submit these documents in which they say, we're going to cut greenhouse gas emissions by X% to ensure that we are aligning with the goals of the Paris Agreement. So these are really, really important climate policies. They're submitted every 5 years. And the WHO looked at how health featured into these key climate policies. And you can see in this graph on the right that certain health outcomes, so for example, heat-related illness, vector-borne diseases, tended to feature quite consistently in these policies. So for example, 28% of NDCs included considerations when it came to vector-borne diseases. But actually, very few of these included any reference to mental health. So only 3% of NDCs include any reference to mental health. And this is very much reflected when we look at other types of climate policies. And we don't have time to go through them all, but I will be sharing the slides after this, and you can see how different types of climate policies, such as adaptation policies, disaster risk reduction policies, again, mental health often doesn't feature in these. To conclude, however, I wanted to highlight that things are improving and we are seeing more and more that policies at the global, regional, and national level are considering mental health when it comes to climate change. And I just provide here 3 examples of global policies that do step into that direction. So in COP28 in Dubai, we saw the Declaration on Climate and Health, which explicitly mentioned that we need to address mental health if we want to provide a comprehensive response to addressing the impacts on health of climate change. The World Health Organization released a resolution last year which explicitly highlights how one of the impacts of extreme weather events on health is worsening of mental health. And again, for those of you that are interested, the WHO also produced a policy brief looking at the interaction of climate change and mental health. So again, just to conclude, we know quite a lot about impacts. We need more research on interventions, and we need for this research and interventions to be translated into policies at the global, regional, and national level. I think we now have, hopefully, yes, around 15 minutes for questions. So apologies for going a bit over time. But yeah.